Hello, my name is Angela Beckerman. I am a licensed professional counselor and a licensed alcohol and drug counselor. I treat people with mental health conditions as well as addiction disorders. Sometimes people have both mental health conditions and an addiction, and I work with those people who are dual diagnosis and have co-occurring disorders. I have 30 years of experience in counseling and working with psychological disorders, and this includes my work in community centers, treatment centers, hospitals, and now in private practice. I have worked with clients in different levels of care, which includes inpatient facilities, residential programs, as well as outpatient programs. The purpose of this video today is to introduce you to my website, my counseling approaches, my specialties, and most importantly, my philosophy when I work with different clients. My specialties include anxiety disorders, depression, social phobia, bipolar, schizophrenia, and also personality disorders, which include narcissism and borderline personalities. I work with people with a long history of working with individuals with addictions. This includes alcoholism, cocaine dependency, and opiate addiction. I've worked in 3 different methadone maintenance programs and also with clients who are being treated with Suboxone on an outpatient basis. As well as being a counselor, I have been a clinical coordinator and program manager of different programs. My most important purpose is clinical practice. And now I would like to discuss more about my philosophy. I want to stress that I do not look at a person in a way that that they are just a symptom, mental health condition, or that they're an addict. I look at the whole person. I treat the whole person, not just the problem or symptom. This is called holistic counseling or client-centered approach. I know that there is more than one factor that contributes to a problem, a symptom, or mental health condition, and many of these factors are physical issues, medical conditions, economic problems, past childhood issues, dysfunctional, unsupportive relationships, and current events. And all these things affect the well-being of a person, how they think, how they feel, or how they behave. From these issues, symptoms develop in which impede on their life and their functioning and make them unhappy. Part of my work with working with someone is I look at these different factors and how they affect someone's feelings, thoughts, and behavior. I look how these symptoms are associated with feelings, thoughts, and behaviors. After examining these different symptoms and how they are caused, then I explore the different treatment modalities. And depending on the medical condition and the person's motivation and what the person is looking to do, we choose a modality. I'll bring up 3 different modalities that I use in my treatment, and there's also others that specifically are spoken about in my website. First, there's motivational enhancement treatment. This is particularly to help people who lack motivation. Some people come to treatment or counseling and they're not sure, why they've come. They know that problems have occurred. So we look at the issues, and then the client can determine whether they want to change and the reason for their change. People need to have reasons in order to change their behavior. The next one is cognitive behavioral therapy. This, I look at how feelings are connected to thoughts that are connected to behaviors. If you change a behavior, you can change a thought or a feeling. If you change a feeling or a thought, then your behavior can change. So we look at those dynamics. The last one I'll talk about is DBT or mindfulness. This is keeping the exercises to keep the person in the present, in the now, rather than looking at being depressed about past events or worrying or being anxious about future events. These exercises help people focus on the now, tuning into their senses. I use, particularly with anxiety, I use breathing relaxation exercises, which slows down breathing, the heart rate, all the symptoms associated with anxiety, which also includes muscle tension. When this is done, they are able to clear their thoughts and change their behaviors. Along at looking at causes and symptoms and utilizing modalities of treatment, I help people evaluate themselves to see if the methods of these treatments are working. Are they effective? Are they reducing symptoms where they're more productive, where they can attain goals? Have their quality of life improved? Do they feel better about themselves? This is the most important thing about counseling, that people improve their lives. They become happier, productive people. Private practice has given me the opportunity and the ability to focus a good amount of time and effort, attention on different cases, to look at the individual as a whole. So I hope this has given you some insight into the work I do with my clients, my counseling practices, my philosophy, and my specialties. You can, if you have any questions or you would like to make an appointment, there's different ways you can contact me, which includes my phone number, 860-227-7326, or my email, angela.beckerman@gmail.com. To review my profile, I have my website that discusses my specialties in detail, AngelaBeckermanTherapy.com. You can also view my profile on Psychology Today as well as LinkedIn. I thank you very much for listening to this video. I hope you can use it. And also, if you feel any of your friends or family could use this video or would like us to set up a counseling appointment, you can give them my contact information. Thank you and have a good day.